morning, everyone, and welcome to Mindfest, Day 3. And thank you for joining us today. My name is Dr. Kenneth Fung. I'm one of the co-founders of Mindfest.
And my name is Dr. Lisa Anderman. Welcome.
Today is our great pleasure to welcome you to Dr. Daphne Korczak and Dr. Jennifer Crosbie's Mindfest presentation, exploring the impact of COVID-19 on child and youth mental health.
We would like to begin with an acknowledgement of the land on which we work, study, and live.
We recognize that many Indigenous nations have long-standing relationships with the territories upon which the sites of the Department of Psychiatry are located that precede the establishment of the University of Toronto. We acknowledge our presence on the traditional territory of many Indigenous nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples. Today, this land is home to many diverse First Nations, Inuit, and Métis peoples, and we're grateful to have the opportunity to live, work, and gather on these territories. We acknowledge that Toronto is covered by Treaty 13, signed with the Mississaugas of the Credit, the Williams Treaty, signed with multiple Mississaugas and the Chippewa bands.
We are grateful to our sponsor, the Dr. Zofia Pakula Social Justice Fund, for supporting this event. It is an honor for us to carry on Dr. Pakula's legacy of compassion and courage. You can learn more about Dr. Pakula's life and legacy at mindfest.ca.
Now, our speakers today are experts in the field of child and youth mental health, and they have conducted research into the ways the pandemic has impacted the mental health of young people in Canada, including young people like you.
Dr. Daphne Korczak is the SickKids Chair in Child and Youth Medical Psychiatry, Director of the Children's Integrated Mood and Body CLIMB Depression Program, a Child and Adolescent Psychiatrist, Associate Scientist at the SickKids Research Institute, and an Associate Professor in the Department of Psychiatry at University of Toronto. Her research activities focus on depression among children and adolescents. Since the COVID-19 pandemic, Dr. Korczak has also been leading a large collaborative initiative examining the impact of the pandemic on the mental health of children with and without pre-existing mental health conditions.
Dr. Jennifer Crosbie is a clinical psychologist and health clinician scientist with the Department of Psychiatry at SickKids and an associate scientist in the SickKids Research Institute Neuroscience and Mental Health Program, and an associate professor in the Department of Psychiatry at the University of Toronto. Dr. Crosbie's research and clinical work are focused on understanding the behavioral, cognitive, and genetic architecture of neurodevelopmental disorders and the development of novel cognitive interventions. With the onset of COVID-19, Dr. Crosbie engaged in longitudinal collaborative research, exploring the impact of the pandemic on the mental health of children, youth, and families.
We are thrilled to have both Daphne and Jennifer with us today. Please join us in welcoming them. Thank you.
So thanks for inviting us to this really neat series. We're really happy to be here and share some of what we've learned over the last 2 years or so with you. So first, we don't have anything to disclose, although this is just a typical spring day in Toronto these days where we are. I'm going to take you back to start with, back to March of 2020. And I'm going to ask us to think back to that time for a bit. And I know that might be a little bit of a traumatic time to think about. But, if we think back then, well, what happened, from your perspective, from the perspective of a student at school, one day we were at school, we were in our activities, life was going on as usual. We headed home for March break. And then, what happened? The world really changed for students and families. So, stores and restaurants closed, and then playgrounds were off limits and sports fields. And then youth couldn't use any of the community recreation centers at all. extracurriculars activities were canceled. And then we had the life-changing news that school would be closed and even childcare. And so we know now that would be the case for the remainder of the school year. And then again for the next year. And for students in Ontario and in the GTA in particular, for most of the next year too, more than anywhere else in Canada. And these changes have really impacted all students, all youth, all families. And what wasn't really immediately appreciated by the adult world is that when we made these changes, we removed the safety net that we'd been building for kids for over 50 years. The protection and the nutrition that schools and communities and extracurriculars afford for many kids. Children became very much locked inside their homes for weeks or months, and we didn't have any of those buffers. But those that have been interested in the health and well-being of children were concerned very early, right at the beginning. And this is a statement made by the director of UNICEF early in the pandemic, who suggested that children were going to be the pandemic's collateral damage, and said, children are not the face of this pandemic, but they risk being among its biggest victims. Really speaking to the idea that we've locked down society and we've closed down our lives, largely to benefit middle-aged and older adults, but kids might be facing some harms as a result. And in my corner of the world, our corner of the world at SickKids, a group of us in child health and mental health were also really worried about the impacts of public health restrictions on kids. And so today I'm going to share with you some of the research that our group has been doing over the last 2 years, looking at the impact. So this is a large study that came about in March 2020, early on, really just based on our desire to try and contribute to our collective understanding of what was happening as best we could. We're scientists, we like to quantify things. So we're trying to quantify the impact, the magnitude of the impact, so that we could advocate for students. So our team is a collaboration of 4 groups, 4 cohorts. So 2 clinical groups and 2 community-based groups of children who came together. And these are kids all over Ontario. So clinical groups, those are groups that are made up of children who already have a mental health or neurodevelopmental disorder before COVID. So could be depression, could be ADHD, could be autism spectrum disorder. Community cohorts are groups of kids who were recruited from centers in the community. So that could be their primary care, like their family doctor, their pediatrician's office. They could have been on a trip to the science center. And then we followed these kids from March over time. And so you can see here at the beginning, this is in March 2020, what our group as a whole looked like. So they were on average about 9.5 when we first started. And you can see that their family's income, about 2/3 or so, families made over $80,000 per year. About 1/3 of them were in that group that already had a mental health problem before COVID, because we're really interested in that group, and about 50-50 male and female. And we asked kids and we asked parents about how they were doing, how they were feeling, and we tried to use measures that we knew to be reliable, that could look at things like mental health symptoms. And we asked them about lots of different aspects of their lives, and you're going to hear about some of that today. We followed them over time. So if I continue on our Ontario timeline, in the spring, as I mentioned, everything was shut for the rest of the year. Then in the summer, we had a little bit of opening, but not a lot. Back in the fall, elementary school kids could either go to school in person or virtually. Teenagers, high school students, couldn't go to school in person. You remember, you could only go in a mixed or hybrid format, in person some days, virtual some days, or you could be fully virtual. Come December, everybody was back in virtual learning full time. And actually, with the exception of a few weeks, February, March time, schools were closed for the rest of the school year. So you can see that when we look at this timeline from sort of 30,000 feet, we can see that from the perspective of a student, there was actually not a whole lot of change over the COVID waves over the course of that first year. So our first objective was to try and determine how the first wave, the very first wave of the pandemic impacted kids and their mental health. And we looked at this among really little kids, preschool age kids and school age kids. And we saw that there was a small proportion of kids, more often preschool age kids, that had some improvement in some of their mental health domains. And we looked at depression, we asked about anxiety, we asked about problems with attention or hyperactivity, feeling irritable, having symptoms of OCD. And so we looked at those and we saw that a small group experienced some improvement in that first wave. But a much larger proportion, almost 70%, had some worsening in at least one of those mental health domains. So this is a graphic depiction. It's almost like a cartoon, but not really funny. And that we helped to create and to share some of our study findings, and we'll include a few more of these in our talks today. So our second objective was to try and determine which factors might be associated with doing better or doing worse. Like, could we understand who was doing better and who was doing worse? And when we tried to look to understand what the factors were, what the drivers were for children doing either better or worse, we realized that the kids and families were sending us a really clear message about what was impacting them the most. So in all domains, regardless of the mental health symptom, the biggest factor was the impact of social isolation. So that included things like not seeing friends, having activities canceled, sports, not having life events canceled like prom or graduation, sort of the opportunity to celebrate your accomplishment. And so from that, we learned that if we wanted to help kids to feel better, the fastest way was to put our efforts into decreasing social isolation and to getting these social interactions and activities back up and running again. We also saw that having a mental health diagnosis before COVID, so having a mental health problem even before COVID started, whether it was depression or anxiety or ADHD, it might be associated with doing better, or it might be associated with doing worse. And it really depends on the person and the problem. So that tells us that just because we know someone had a mental health problem before COVID, doesn't mean we can assume how the pandemic has affected them. So mental health disorders are heterogeneous, they're highly variable. And so we have to know more about the person and their specific circumstance to know how to support them. Also, we saw that for a small group of children who actually felt a little bit better, having some COVID-related economic impacts and financial impacts was associated with doing better. And that was a little bit strange to us and an interesting finding. And we wondered whether that might have something to do with the universal benefits, the support that the government was offering some families, and how that might have decreased their work-life stress during that time. But we're really interested in that finding. We tried to try and drill down a little bit into it a little bit more. So we looked at our sample, our kids, with about something called material deprivation. It's sort of whether families had enough to get by. And here is what our group looked like in terms of how many had difficulty. Were they worried about where they were going to live, or whether they would have enough to eat, or whether they might lose their job, or whether they'd be able to earn enough money. You can see the proportion, the percent of people in our study sample who had those worries. And we're able to take all those concerns and look at them all together to see how kids and families were impacted over time. And so there might be some people here really interested in statistics and data analysis. And so we use this method called the structural equation model to look at it. And that lets us look at different measures and associations at the same time. So early in the pandemic, by using those data, we were able to learn that families with lower income and families who had a child who had a mental health problem already had greater material deprivation due to COVID. They had more job, food, housing insecurity. We also found that parents with more mental health problems experienced more stress related to the COVID restrictions. And so we kind of expect that mental health symptoms and stress might be related, but what we found was that mental health symptoms predicted stress more often or more strongly than the other way around. So what that means is, yeah, if parents are stressed by COVID restrictions, they feel worse. But more importantly, if parents are unwell, they find the restrictions more stressful. So impacting parents' mental health might have a larger effect on how well parents cope with COVID restrictions than the other way around. And we found that parents' mental health and children's mental health were contributing to one another equally. And so we always know that there's some interaction there between how parents are doing and how kids are doing. But what we found during COVID was that this was really equal and balanced. And that's really important as we think about how we're going to design and provide mental health services over the coming months and even years. So right now, some of you may know, when we deliver mental health services, we deliver them in one place for children and in another place for their parents. And our findings suggest that if we want to help children do better, we should provide those services in the same place, or at least look at how parents are doing at the same time as we're looking at how kids are doing. So our findings about how important parents' mental health on students' mental health are during COVID has also been shown in this study from Alberta. This particular study is by a group in Calgary led by Dr. Sherry Madigan. And these are kids who've been followed since pregnancy, and kids are now also about 9 to 11 years old. And they looked at, what were the features or the factors before COVID that were important in figuring out how kids were doing during COVID. And not surprisingly, and pretty similar to the findings I've already shown you, one of the strongest predictors of how kids were doing during COVID is how they were doing before COVID. So over and above that, though, and equally as important, was how connected kids were feeling to their parents. So again, sort of highlighting the importance of families. So kids who were not feeling connected to their parents were having more distress during COVID. And they also looked at some of the daily routine factors, like time spent on screens, for example. And Dr. Crosbie will talk a little bit more about that later. So from all this work on parents and families, we can draw sort of two implications. The first is that it's important to support families financially during times of crisis. And the second is, when we treat children and youth, we should think about treating their parents. So now I want to turn a little bit, look at depression and anxiety among children and youth, because we've heard a lot about it during the pandemic, and it's important to look at the evidence. So we are fortunate in our study to have to know a little bit about the kids from before COVID and know how they were doing. And so what we have done is we looked before COVID to look at how they were doing in depression. So did they have a lot of depressive symptoms or not? And then use a standardized measure and look at the same measure over time in the first few months of the pandemic. So we looked at kids with a mental health problem. Before COVID, and those are in blue. And then we looked at those who were previously well in orange on this measure. And this is a measure that's scored based on large samples of kids and scored based on their grade and sex. So in our healthy sample in the orange, we see that they start out before COVID exactly where large samples of groups of children start, with an average score of 50 and a standard deviation of 10. But during COVID, we see that a big jump in their score, nearly a whole standard deviation. And that gives us the suggestion that children, and particularly previously healthy children, have had a significant increase in depressive symptoms during the pandemic compared with their pre-COVID selves. So there have now been several studies looking at this that have been published, each with different effect sizes, meaning that the estimates of how much this has affected children has varied quite a bit. And that's why I like this other paper that came out in the fall, which was also from Dr. Madigan's lab, that looked at this question globally. So looking at 80,000 kids in 29 studies around the world, and finding that across all these studies, that 1 in 4 youth are experiencing clinically significant depressive symptoms and 1 in 5 are experiencing clinically significant anxiety symptoms. And that these rates were higher among older teens, among girls, and that rates were higher later into the pandemic, into 2021. So the thing about those numbers, we can compare that with pre-pandemic estimates, in which about sort of 1 in 10 youth were experiencing clinically significant depression or anxiety. So these studies in global analyses, they're all cross-sectional studies. So that means they only look at people at a single snapshot in time. And as you might already be able to tell, that has some limitations. So what we really want to know is, how are people doing over time? Sometimes you call that longitudinally, following kids over time. So many people have said, for example, what these studies, including our study, is capturing is essentially an adjustment reaction, a problem adjusting to the COVID pandemic. And because kids and youth are resilient, these increases will be short-lived, they'll be transient, and they shouldn't be too much of a cause for concern. So, we are scientists and we like to test hypotheses. And so we thought, okay, well, we'll examine that a little bit more closely. And so to do that, we looked at parent and child reports of depression and anxiety symptoms over the course of the first year of the pandemic. So I'm going to show you a couple of figures that look a little bit complicated, but I'll take you through them. So this figure shows the proportion of kids with clinically significant symptoms of depression or anxiety. So that means the proportion or the percentage of kids that have symptoms that are severe enough that they might warrant referral to a specialist for consultation. They might need treatment. And here, I've broken the figures down by age. So if you look at the figure, you'll see anxiety is in red and depression is in blue. And the lighter shades are younger children, 8 to 12-year-olds, and the darker shades are adolescent high school age children. And there's only a couple things I want you to take away from this. This is looking at 3 time periods over the course of a year. And what we see is older children are certainly doing worse than younger children, but those numbers for younger children are really much higher than we would normally expect to see. That we also see fairly consistent numbers across the 3 time periods. So there's not a lot of change between one time period and the next. And this figure is similar in that it shows the proportion of children with clinically significant symptoms of depression or anxiety, but now it's broken down by whether or not the person had a history of mental health problems before COVID. Remember, 1/3 of our group had that. Again, anxiety is in red and depression is in blue. And this time, the lighter shades are children and adolescents with no previous mental health problem. And again, we see some concerning numbers, particularly the lighter shades. These are kids with no previous mental health problems. And we're seeing numbers, around a quarter, a third, in terms of percentage of kids who are having clinically significant symptoms. But again, when we look over the course of the year in those 3 time periods, we again see relatively similar numbers, not a lot of change over the year. And so we see that although the COVID pandemic has occurred in a series of waves, the increase in depression and anxiety among children and youth, what kids have experienced has been pretty constant, pretty consistent. And so these findings tell us that now we have children with no pre-existing mental health problem who now have clinically significant symptoms of depression or anxiety, that kids with a pre-existing mental health problem might now require more support. And again, what did we see as a key factor? Social isolation. So we see that those public health measures that result in social isolation are associated with sustained deterioration of mental health for children. So now I'm going to hand it over to Dr. Crosbie to talk about some of our other findings.
All right. Let's see if I can take over control from Dr. Korczak. It looks like it is working. Okay, well, Dr. Korczak's done a great job of really setting up the study that we did and some of the findings that she's reviewed. I'm going to take over and I'm going to tell you a little bit about some of the results we looked at and what we found when we explored the impact of screen time, changes in school format and what was being offered in school, as well as access to things like sports and recreation. There we go. All right, 1 second. Oh, there we go. Okay, seems to be working for me now. All right, so we looked at screen time usage across a range of different ways. We looked at TV and sort of watching Netflix, that kind of screen time. We looked at video game use, virtual learning, so doing school from home, and also the impact of video chatting. So when people actually are having social interactions with people live, with their friends live, using phones and screens. And what we found was that the more time spent watching TV, on digital media, or on video games was associated, slowly moving forward for me. Oh, there we go. It was more time on any of these kinds of screens was associated with an increase in traits of irritability, hyperactivity, inattention, anxiety, and depression. We all know that when schools closed, that resulted in more online learning. And when we looked specifically at online learning, we also found that it was associated with increases in depression and anxiety symptoms. So in fact, when we looked across both our younger and our older age groups, as you've already heard about, and we looked across these different areas of screen times, what we found is that in the younger children, we saw increases more so in irritability, hyperactivity across these different traits. And as we got into the older age group, we also saw an increase in reporting of anxiety and depressive symptoms. So you can see as individuals in our study got older, the impact of screens seemed to be expanding across a range of mental health concerns. And we'd had a hope, a hypothesis, an idea that maybe the ability of people to actually have conversations with people on screens, so real live interactions like video chatting, might actually offset this, like be protective. And while it wasn't associated with an increase in mental health concerns, it did not end up decreasing it over time. So it was not that this was protective, that this having video conversations didn't increase mental health, but it also didn't protect from the onset of the concerns. So what are some tips for managing screen time? I'm going to start throwing in some tips and some ways of thinking about how we might be able to move forward from some of our findings. So I know you've all heard tips for screen time. So as I go through these, I want you to encourage yourself to think about what would be useful for you. So try to limit screen time use to less than 2 hours per day for recreational screen time use. I know many of us have to use it for work or school or what have you. Screens out of the bedroom at night. So when you decide to put it away, put it somewhere else, charge it somewhere else so you're not tempted. The pinging and the dinging is not going off. It's not the first thing you do in the morning. Decide when you're going to turn it off and go to bed. Prioritize in-person social encounters over screens. So make plans to see people and do things. If an opportunity comes up to do that, choose the in-person social encounters rather than sitting on screens or saying that, oh, chatting with my friends on the screens is the same as an in-person encounter, because it's not. That has a place, but we really want to encourage times off of screens for socializing. And actually, I would encourage you all to create your own media plan. I know parents and teachers and everybody will tell you what to do, but you need to make good choices for yourself. What are the rules you're going to set for yourself and stick to it? Maybe it's no screens at dinner or during meals. Maybe you decide that when you're with friends and you're out doing things, you're going to put the phone away, or at least you're going to put the phone away. Turn off notifications at certain times. If you're doing homework, if you're sitting in a class, or if you're out with friends, that might be a good time to turn off the notification so you're not constantly distracted. You can decide when you're going to look at the screen. So the next data I'm going to share with you had to do with understanding what exactly was happening in school. So once kids in Ontario went back to school at the high school level and at the grade school level, what were the restrictions like and what were they doing? And I'm just going to highlight the high school results because it's a bit easier than showing both the grade school and the high school. And what you see here is a rating of different kinds of public health measures, such as wearing masks, keeping distance from people. And anything above 3 indicates that it's most of the time or all the time. 3 would be neutral, and 2 and 1 are pretty much not at all. And so what you can see here is that Ontario students were doing an excellent job of following the public health measures, which is great to see and likely accounts for the fact that, in many regards, COVID didn't spread, particularly in the early days, so fast through schools. But what we also see here in the blue, this has to do with working in small groups or having one-on-one time with the teacher, what we might call these more social school activities. And not like socializing with your friends, but actually like interactive learning exercises. And what we see here is that students reported that barely happened at all. So this rating of 1 or 2 is showing that students are saying that this isn't something that happened. So even though we went back to school, school didn't really feel like school, and it didn't include that kind of social interaction that we know is so important to positive mental health. So on the one hand, really good at following those public health measures, but on the other hand, even when it came to academic interactions of a social nature, there was a lot less of that, and might really be pointing to the fact that even for kids who were in school, maybe it really was not what school was previously. The other thing that we came out of this research was when we talked to students about what kind of access they had. So for students who were at home doing virtual learning, 31% of them reported that they had no quiet, distraction-free space to do school. So many families were managing in small spaces where there was many distractions and things going on. And so really the ability to sit down and concentrate and really kind of focus on what was happening in virtual learning was extremely difficult. So when we looked across, the next thing that we looked at was what was the impact of learning environment on mental health in kids who were in grades K to 8 and 9 to 12. And what we found was that there was when you increased virtual learning, so the increased amount of time that was virtual learning was associated with depression, anxiety, irritability, inattention, hyperactivity in the younger grades. And similarly, for the older grades, it was associated with depression, anxiety, and hyperactivity. So we really saw an association with an increased mental health difficulties for those who were doing more virtual learning. And the thing that we found is we looked a little bit at this group of individuals who had pre-existing mental health concerns and those who didn't, which I know Daphne talked about earlier in her presentation. And what we found there is actually that the individuals who had pre-existing mental health definitely struggled. And regardless of whether it was in person or virtual, those traits remained. What was striking for us is that the youth who did not have pre-existing mental health, there was a clear association that the increased time in virtual learning for them was associated with significant increases or more of an association with mental health, negative mental health outcomes, including depression, anxiety, hyperactivity, and inattention. So we really saw that those youth who did not actually have pre-existing mental health concerns were quite impacted by an increase in the virtual learning environment. So next, we looked at what was the impact of loss of sports and extracurricular activities. So we know with the pandemic, everyone had to go home, but even when kids went back to school, one of the things that didn't exist was sports and recreational activities. It was like all the school and all the school work, but none of the fun. And we know that those are the things that for many kids really are beneficial to them. So we wanted to understand this better. So before COVID-19, 58% of children and youth participated in sports and extracurricular activities at school. During COVID-19, only 27% of kids who went back to school participated in sports and 16% in extracurricular activities. And overall, 50% of children and youth reported this as being extremely difficult for them. So our data shows that it's very important for youth and children to have in-person school recreational and social activities. It's not enough just to go back and get your academics. We need to have an environment where kids can also have sports and these recreational and social activities. So I'm just going to highlight a little bit of this results to unpack it a bit. So this is during the pandemic. So this is showing you individuals during the pandemic who did participate in sports. So the light blue bar is those who were participating in sports, and the dark blue are those who did not participate in sports. And what you can see here is that those who did not participate in sports had this significant increase in inattention across this period of time. And similarly with extracurricular, so not everyone likes sports, so this can be clubs or choir or whatever it is that you like to do. Again, you can see here that those who did participate much lower rates than those who did not participate. And what was interesting, and I'm not going to show it here just to keep things simple, is that this study looked at people who have managed to participate in these activities during the pandemic. But what was interesting is we also looked at individuals who had participated quite a lot in these kinds of activities before the pandemic. And what we actually found is that it had a bit of a protective effect, a bit of a buffering effect, and that those who were engaged in these kind of activities before the pandemic, it seems to bode well for them. And overall, they reported lower levels across a range of mental health traits. And it wasn't just hyperactivity and inattention we looked at. We looked at across, so this is this result that I was just telling you about, the pre-pandemic results. So you can see that for extracurricular activities, there was less hyperactivity, and for sports, there was less anxiety and better attention. And the results within the pandemic, so for kids who participated in these sports in the pandemic, you can see that for extracurricular activities, it was associated with better mood and better attention. And for sports, it was associated with better mood. So we can see that buffering, that beneficial effect of activity across a range of different mental health traits. So what are some tips for trying to get recreation? And I know it's been hard and things are just opening up, but it's worth making time and figuring out what you like to do and doing it. So you want to find an activity you enjoy and try to make it social. Friends, family, going for a walk, going for a hike. It doesn't need to be organized sports, it just needs to be something outside that you're enjoying and you're doing. You want to prioritize active transport or outdoor time. So again, try to choose to do something that involves some kind of activity rather than say a screen or passive kind of sitting around. Ideally, you want to get 60 minutes of heart pumping physical activity a day. But I have to say, honestly, these results are really pointing to sports, which are really important for your health, but also just other activities as well. So try to get re-engaged in the things that you enjoy and you like, and if you can make it social, even better. So this is just a little schematic that Daphne and I found a little while ago, and I feel like it really captures some of the data that we've presented here today. You know, the pandemic was difficult. It's lasted a long time. I know we're all have high hopes that it's done and over with, but you know, things are just opening up, and it's been 2 years, so it's not as easy as just going back to the way that we were. We're all 2 years older, and things have changed in many, many ways. So this schematic's really just showing that by and large, everyone tried really hard to make the best of bad situation. And I think that there's lots of anecdotes and examples where that happened, but I think our data also shows that it was a very tough time for many children and youth and their families. So what are some strategies, some general strategies? And we've left lots of time here from the discussion that myself and Dr. Korczak can kind of maybe answer questions or provide a little bit more details. But, you know, in a time of uncertainty, there are some key things that we can try to keep in mind, some simple strategies for trying to keep mental health, you know, keep our mental health up. So daily routine. So what am I going to do? What's the family going to do? What's coming next, and sticking to it? Healthy living, eating, sleeping, and exercise. These really are key pillars. And in the pandemic, it was so easy for these to fall off the rails, like less sleep, up late, looking at screens, you know, not going outside, not getting activity, lots of, you know, perhaps snacking on unhealthy foods. Really just trying to get back into those key pillars can make a big difference quickly. And social interactions. If our results have shown anything, that the lack of real in-person social interactions was associated across the board with many of the negative outcomes. So as we have the opportunity to interact with people, we want to be doing that as much as possible in our own individual ways. And that can look really different for people. You know, there's social butterflies who are going to see everybody right away. For other people, you know, maybe not socializing so much that it's a bit daunting to think about kind of getting back out there, but that's okay. Start small, figure out, you know, who you like to see, make a plan, go see them, and then try to build up those social interactions from there. But the key is to do it on a regular basis, have a plan, and make it part of your regular routine. Like, how are you going to interact and socialize with people on a regular basis? So these slides, I believe, will be shared. So I have some resources here. I don't need to go through them in detail. Many of you, or hopefully many of you, know of them, but they will be available. And I think some of them have been thrown up in the chat. And I've tried to include, or we've tried to include, a range of resources, some that are maybe a bit better for, say, high school students versus some that are good for young adults. But there's quite a wide range here. And I think more and more there are some excellent resources available. This was a big study, and it involved a lot of people, and it involved, most importantly, incredible participation from parents and youth and children at a time when things were very stressful. So before I thank anyone on the team, I mostly have to thank those, as does Daphne, as well as our generous funding partners. But we really had an excellent team of researchers who were still working away to try to understand the impacts. So with that, I'm going to leave this slide up and open it up to discussion and questions.
Thank you, Daphne and Jennifer, for a wonderful presentation. For those of you that don't know me, my name's Ben Gain. I'm a communications coordinator in the department, and I look after a lot of Mindfest planning. And I'll be assisting just with questions here. So if you have a question, please do enter it in our Q&A box, and I will pass it along to Daphne and Jennifer. So to start, are there any specific recreation measures that are shown to alleviate depression symptoms in young children? And the person asking the child in question is a 6-year-old girl.
Daphne, I'll hand that over to you.
Okay, thanks. Sorry, I'm still trying to figure out my gadgets here. Sorry, 6-year-old to alleviate depression symptoms. So we don't see this. I think that's one of the things about the pandemic that's striking is, you know, usually we don't see a lot of depressive symptoms in kids that young. And what we have been seeing is that younger kids are not doing as well, and they are sort of seeming a bit lower energy, a little bit sadder, a little bit less sort of excited to do things. And, you know, they've had 2 years, a 6-year-old has had a third of their life now in COVID, which is, you know, pretty significant. And I wish we had an intervention study that would sort of speak to your question directly. We would like to be able to follow kids long enough that we can see who's doing better and why they do better and what kinds of things lead them to do better. Because I think that will be really important. We know that some kids are going to get better faster than others. Some kids are going to take a while to get better, and some kids won't. And so right now, what we can think about is to think about the kinds of things that we know are contributing, the kinds of things that seem to be drivers, and think, can we address those? So those are some of the things that Dr. Crosbie talked about. Can we get to do the kinds of things like have more social interactions, introduce them, probably forgotten what they like to do if it's, sports and activities outside of school, reintroduce them to different things as they start to become running again, as we start to have warmer weather again, and start to get them involved in life and involved in living. And we are hopeful that if we can address those contributing factors, that for some kids we'll start to see them feeling better again.
Great, thank you, Daphne. Our next question, will study participants be followed for long-term impacts?
I'll jump in here. This study is ongoing, so yes. And we started this study off, I remember it well, a quick conversation between Daphne and I, among some others, and thought, we'll just do this over this pandemic that looks like it's not going to last for very long, and it just keeps going and going. So much of our original funding was just for 1 year, and now we're going back and getting it renewed. But there's most definitely a plan to follow this study long term, to continue to look at the impacts as new things come along with that pandemic. As a group, we're trying to add questions in to explore what's going on. As things open up now, you can imagine we'll be interested to sort of see how what some of the trajectories look like over the next little while, the next few years for sure.
Great, thank you, Jennifer. Next question. During this time, is it possible to accurately diagnose a new mental health disorder like ADHD?
All right, I'll take this one. I think that the pandemic definitely has created some difficulties in really understanding what's going on because the exposures and experiences of kids has been quite different than what we are used to. However, most definitely, those of us who work clinically can do an assessment with a family, get all of the information. Getting information about how things were before the pandemic can have an impact, learning about what their current environment is, if things change from when they were doing virtual learning to, say, in-person learning at school. So it definitely makes things a little bit more complicated, but it is possible to possibly review a case and feel like a diagnosis of ADHD or any other kind of mental health diagnosis is possible. But you'll definitely want a clinician who feels comfortable sort of integrating all the information. And it may depend on the age of the child. So there's a number of factors in there, but it is possible, but definitely the pandemic has made it a little bit more complicated.
How can we prepare staff who are working with youth in recreational camp settings this summer to be better equipped to support children and youth?
Sorry, I think I cut out. Can you just say that again, Ben?
Certainly. How can we prepare staff who are working with youth in recreational and camp settings this summer to be better prepared to support children and youth?
Well, I think that's a great question. And it's probably something that we're all thinking about, is how do we support kids in this next little while, and what are we going to see? And I think being aware is really important. So even to the point where that person is asking the question, is sort of starting to think about, okay, so kids are coming into camp, and there may be, just be prepared that there may be a variety of responses to the pandemic. And as I showed, it's hard to predict necessarily based on someone's history how they did during the pandemic. So we have to be sort of prepared that kids are going to have quite a range of responses. And some kids are going to be really super excited to be there and want to do everything because they finally can do all this stuff. And some kids are going to be timid, and they're not going to be so keen, and it's been a while since they've had sort of group interactions. There has been, so we have to be sort of mindful of that. We also have to be able to talk with the kids, to help the staff talk with the kids about, how are you feeling? And, this doesn't have to be sort of a large part of the day or, in-depth conversations, but to sort of let kids know that we know that feelings exist and kids have feelings that might change, and it's okay to sort of say how you're feeling and to think about how you're feeling and what might be helpful. And so I think for staff to be aware of that and to try and meet kids where they're at and get them back involved in things and just be probably a little bit more understanding.
Thank you, Daphne. Did having siblings or bigger families, such as having more adults at home, help with social connection, or was pure social connection the most important?
So we have data that sort of collected that information, and we have not yet looked at it at that level, but we're hoping to have an opportunity to do that soon. There was another question in the chat that kind of relates to this, sort of around family, families who were able to comply with public health measures or, access to outdoors, those kinds of questions. So we have yet had an opportunity to look more fine-tuned to see whether or not that was a factor, but hopefully we will be able to over the next little while. So we do have the data, we just haven't had a chance to actually analyze it yet.
What do you predict the long-term effects from lack of socialization will be on young children? And is there a way we can mitigate the negative impacts?
Okay, well, I'll start, and then Jen, if you want to jump in, go ahead. So I would say we are learning as we go a little bit. We, as Jennifer mentioned, we sort of naively thought that this pandemic would be over 6 months to a year, and so our definition of long-term has been changing as the pandemic has been evolving. So now we're sort of hopeful that we're toward the end of things and things are going to get better. We're still waiting to learn a little bit about what the pandemic will do. I think what we have seen so far is, as I mentioned, a huge variety in responses, lots of variation. So while some kids seem a little bit more resilient, others are not bouncing back and not bouncing back quickly at any rate. And it probably has something to do with the developmental stage kids are at. How old were they when this was happening? It probably has something to do with how many things or how involved or what their temperament and activity level were like before, and their experience of school was like before. So, how much some kids had lost a lot, some kids lost less in their sort of experience of what they needed and what they were involved in as they went through the pandemic. And probably to some extent depends a little bit on what they're going back to. So, what does that look like now? And were they in high school and now they're trying to figure out university, and they've kind of navigated this time that's already tricky during a time that has been, very, very difficult? Or, were they already in the same school? Have they been going through with the same people, the same teachers? Some kids have really made transitions, and we know that is probably associated with having a tougher time, for example. So I think we'll have to follow kids and try and understand which kids we need to sort of hone in on more. But we are seeing some patterns, and as that one meta-analysis showed, things like older teens, especially teenage girls, seem to be having more trouble with certain symptoms. Younger kids having trouble with different symptoms, and so we'll have to pay attention to that over time.
Thank you. Was there, so in terms of adults who were projecting their fear, anger, and anxiety over COVID, do you find any evidence of that added to children's perception that the world was unsafe or scary? And if there was a situation like that, what can we do to help alleviate that?
To start? Okay, I can start.
That harkens back to the data you presented today.
Yeah,
Yep.
and we did have a separate study, but we did find that parents who were more anxious tended to have kids who were more anxious. We know that anxiety is hereditary, but we also know that modeling is important in anxiety, and so both of those things probably combine in this situation. So, so really important for parents to be aware of those and to model healthy coping skills. So instead of sort of modeling more anxious or avoidant coping strategies, really modeling. So I know it may be scary, but it's safe, or I haven't done it for a long time. It might be scary, but I can do it. And those kinds of more healthy strategies. And I think when children often learn from seeing their parents, and when they see their parents do that, and they see their parents being able to go into those situations, it helps to provide kids sort of with the confidence that it is safe and they can do it.
Thank you. I think we have time for one more question. So parents have been asked to select in-person or online learning for the 2022-2023 school year. When or would you ever recommend online learning?
So I'll comment on this. First, I'll say that each family and each person has their own set of factors associated with these decisions. So that, I think, is always the key in these decisions. What our results would show, that sort of putting some of those aside, that if there's not sort of medical or other, this environment is key, and there are a few, but in a situation where that's not a factor, and there's not some clear reason as to why the virtual learning environment is kind of necessary for health, we would encourage in-person learning as much as possible based on the results that we have. Yeah, so by and large, all things being equal, however, there are many individual factors that any family needs to put into that kind of decision.
Yeah, I would agree. And I guess the only thing I would add is that I think if there's a family that's considering continuing virtual learning for their child, I would suggest that they maybe speak to their family doctor, their pediatrician, their kid's school, and sort of really understand, why are you considering that? Why are you thinking about that? And really sort of discuss with them, what the concerns are and whether that's something that makes sense going forward. But so far our data would say, it's better to be in school than at home alone and online.
Yeah.
Well, Daphne, Jennifer, thank you so much for joining us today at Mindfest and for sharing everything you've learned, your expertise. It is much appreciated. And thank you to everyone who joined us for today's presentation.
Thanks so much.
Thank you very much. Take care.
Thank you so much, Daphne and Jennifer.